Hi, my name is Karen Alanis, and I'm on the Heritage Committee at the University of Minnesota School of Nursing. This committee is part of the school's Alumni Society. In this video, we will discuss the history of the acquisition of psychomotor skills at the University of Minnesota School of Nursing. Psychomotor skills are clinical nursing techniques that nurses perform in the process of caring for patients. The history of psychomotor skill acquisition in the pre-licensure program has progressed in specific time periods. Within each time period, the focus of the teaching methodologies, the leaders, and the teaching settings are presented. The period from 1909 through 1960 is conceptualized as apprenticeship and the art of nursing with an emphasis on procedures. A de-emphasis of teaching nursing psychomotor skills occurred in 1960 to about 1975 due to curricular changes. Reinvention of the definition and teaching methodologies took place from 1975 to 2012, with an emphasis on caring for the person. Beginning in 2013, an innovative approach and laboratory facility emerged with a focus on community. The teaching of nursing psychomotor skills began first in the hospital setting, utilizing an apprenticeship model, whereby students learned by staffing the hospitals affiliated with the School of Nursing. Psychomotor nursing skills in that era were termed nursing arts. In 1929, the School of Nursing was now the Central School, and students utilized 4 hospitals for instruction and practice. Barbara Thompson was the University of Minnesota instructor and coordinated the coursework. Dean Marion Vanier and Barbara Thompson published a nursing procedure manual to provide instructional consistency between the 4 hospitals. The authors state that many other schools of nursing, as well as medical school programs, requested copies of the publication, which is believed to be the first published procedure manual. The outcomes published in the manual illustrate the reason for the name Nursing Arts. Barbara Thompson, pictured here, was honored for her contributions at the 50th anniversary of the School of Nursing. The procedure manual published by Vanier and Thompson outlined the philosophy for teaching psychomotor skills, the prerequisite coursework, the course content, and specific procedures. For example, this recruitment pamphlet illustrates one procedure in the manual that outlined the technique for giving a hypodermic. By 1929, the psychomotor skills were taught and practiced in the classroom as well as at the hospital. The settings for the teaching of nursing psychomotor skills began to take place in nursing arts laboratories located in the specific hospitals where the students practiced. This is the laboratory in Minneapolis General Hospital, utilized by the University of Minnesota School of Nursing. During World War II, the School of Nursing increased their enrollment to provide an education for the Nurse Cadet Corps and had to teach nursing psychomotor skills in Northrop Auditorium on the campus of the University of Minnesota. Powell Hall, on the campus of the University of Minnesota, housed classrooms, dormitories, and offices for the School of Nursing. In 1945, a nursing arts laboratory was included in an addition to Powell Hall. Nursing arts instructor Agnes Love is teaching in the Powell Hall Amphitheater. Agnes Love was honored for her contributions at the 50th anniversary of the School of Nursing. The curriculum did change in 1963, a period in both the country and the University of Minnesota School of Nursing in which faculty attempted to teach within a nursing rather than a medical context. The curriculum had less emphasis on the teaching of psychomotor skills. Change is difficult, and in this case, the first attempt did not work well, resulting in the National League for Nursing mandating curricular changes for the School of Nursing. The faculty made changes, but remained committed to teaching within a nursing disciplinary context. During this 1960 to 1970 period of change in the curriculum, Dr. Sheila Corcoran, associate professor at the School of Nursing, published an ethical examination of the use of clinical facilities as learning laboratories. Dr. Corcoran determined that yes, it was ethical to use clinical facilities as learning laboratories, but under certain conditions. One of these conditions was that the clinical setting be used for learning objectives that could not be achieved in any other setting. This ethical reflection, as well as the conditions, set the course for the expansion of the psychomotor skills curriculum and laboratories from 1975 to the present day. In the period following the de-emphasis of psychomotor skills, Blossom Gullickson, Joanne Stenberg, and Lois Freeberg-Requa were leaders in the reinvention of the nursing psychomotor skills curriculum and laboratory. The teaching of psychomotor skills changed from lists of procedures to the performance of psychomotor skills, utilizing clinical judgment within the context of a particular patient and their history. Here, Joanne Stenberg is teaching intravenous therapy using a simulated circulation system she designed and described in a nursing journal. Ms. Stenberg began the Minnesota Baccalaureate Psychomotor Skills Faculty Group in response to faculty members from other baccalaureate nursing programs in Minnesota who shared with her that they wanted a format for meeting with other faculty who taught skills in order to improve their teaching. The objectives in the laboratory manual for the acquisition of psychomotor skills were labeled according to Bloom's taxonomy of learning domains. The definition of psychomotor skills was expanded to include the use of clinical judgments based on cognitive understanding of the theories and principles guiding the action, competent performance, and an intention to care within a nursing disciplinary context. The psychomotor skills courses were named nursing tools in the 1980s, nursing psychomotor skills in the 1990s, and nursing fundamentals in 2000. The reinvention of the Psychomotor Skills Laboratory, curriculum, and teaching learning methods began in Powell Hall Nursing Arts Laboratory and moved to a 15-bed laboratory space in Weaver Densford Hall that included 8 health assessment rooms. In 2003, the nursing program expanded to the Rochester campus, including a skills laboratory at that site. In 2008, the nursing students began to utilize the Academic Health Center's Interprofessional Education Resource Center, IERC, and Simulation Center. During the reinvention period in the Psychomotor Skills Laboratory in Weaver Densford Hall, many faculty were instrumental in psychomotor curriculum development, instruction, and the development of simulation case studies. Miss Jessie Daniels was one of the charter members of the Minnesota Baccalaureate Psychomotor Skills Faculty Group that met monthly to dialogue about how to improve psychomotor skills curricula and instruction. The members of this group published their experiences in the Journal of Nursing Education. Dr. Sharon Ridgway, one of these faculty members, pictured left, is with Professor Kiko Chikata from the College of Nursing Arts and Sciences in Japan, who is a visiting scholar working with Dr. Ridgway in the Psychomotor Skills Laboratory. Dr. Ridgway was a member of a multi-site research team of other baccalaureate skills faculty in Minnesota that studied how to incorporate the concept of caring in the psychomotor skills curriculum. The results of that study were published in the Journal of Nursing Education. Dr. Mary Steffes, another of the Reinvention faculty members, was instrumental in developing the psychomotor skills curriculum, instruction, and case studies for the critical care course that was delivered in the 1990s. Additionally, she was a contributor to the chapter on application of heat and cold in a book for nurses about alternative, complementary therapies. Dr. Mary Rowan has taken the lead in developing simulation case studies for nursing students utilizing the technology in the Academic Health Center's Interprofessional Education Research and Simulation Center. Standardized patients and students interact utilizing the simulated case study as they are videotaped, and after the interaction, both the patient and the student submit electronically answers to questions regarding the encounter. The Institute of Medicine challenged nursing educators to prepare students to fill expanding roles and to master technological tools and information management systems, while collaborating and coordinating care across teams of health professionals. One innovative response to this challenge by the University of Minnesota School of Nursing follows. In 2012, the School of Nursing celebrated the beginning of construction for the new Healthy Communities Innovation Center. This center provides students with opportunities to engage in complex simulated health scenarios with interprofessional teams and uses sophisticated telehealth as well as emerging health records technology. Dean Connie Delaney, Dr. Sandra Edwardson, former Dean, Dr. Karen Alanis, and Mary Lou Christensen are celebrating the beginning of construction of the HCIC. On Thursday, April 18, 2013, the University of Minnesota School of Nursing opened the new state-of-the-art education center for nursing and other health professional students. The facility is named the Benston Healthy Communities Innovation Center, named to honor the lead gift made by the Benston Foundation. Nursing today can play a pivotal role in healthcare reform, said Dean Connie Delaney, Dean of the School of Nursing. We look forward to sharing the Benston Center with community and educational partners to advance the effectiveness of healthcare providers and systems. The 11,000 square foot simulation center features 38 remotely controlled video cameras, interactive video conferencing capability, a medication dispensing technology room, simulated intensive care, hospital, nursing home, clinic, and home care environments, thus providing transitions from acute care back to the family community. The School of Nursing's nearly 900 undergraduate and graduate students can record and critique their individual learning activities involving high-tech, remotely controlled mannequins that simulate actions like breathing and responses to nursing interventions and treatment. Marie Manthe, chair of the Heritage Committee, is with students in one of the clinic rooms. Students are able to learn and practice critical care psychomotor skills with a mannequin simulator in the critical care setting in the Densford Center. Students have the opportunity in the Densford Center to learn to use transfer equipment that will be available in acute care and long-term care settings. In summary, the history of psychomotor skill acquisition in the pre-licensure program in the University of Minnesota School of Nursing progressed in specific time periods, and each time period differed according to teaching methodologies, faculty leaders, and teaching settings. The Heritage Committee wishes to acknowledge and thank the members of the committee who were instrumental in the compilation of this history.
Oh.